Tony Richardson has been cutting hair for more than a decade. He works for himself and doesn't qualify for employer-based health care coverage. So he's had to think twice about going to see a doctor. And when he does, it costs a lot.
I don't catch colds. I gotta get some antibiotics or something. Can't afford it.
But that's changing. This week, for the first time, Americans like Tony can now shop for health coverage as a result of President Obama's health care reform law, set to take effect next year. On October 1st, enrollment began and millions are now beginning to sign up. In New York, 2 million people shopped for health insurance the day the website opened. In Illinois, that state's averaging more than 50,000 residents checking out their health care choices each day. And in California, the state's website is getting more than 1 million hits a day, as many previously uninsured residents shop for medical coverage for the very first time.
That gives you a sense of how important this is to millions of Americans around the country.
It's important to millions with pre-existing conditions like asthma, diabetes, or high blood pressure. They can no longer be refused health insurance. The White House hopes to sign up 7 million people by December, but not every American will have that opportunity. There are still millions in the U.S. who will not be covered. That's because the very people the new law seeks to help live in states controlled by Republican governments who oppose President Obama's health care reform law. In total, 26 of 50 U.S. states have refused to adopt one aspect of the law that seeks to expand existing medical coverage programs for vulnerable groups. It's something that the U.S. Supreme Court ruled was constitutional last year.
I think the contentiousness is going to change. There may be conservatives who don't like it, but they're not going to try and take it away because it will be politically unpopular to do so.
But for now, they're trying, and that's the reason for the U.S. partial government shutdown. Republicans are refusing to agree to funding to reopen the government unless the president's health care program's delayed. It's something Tony Richardson can't understand.
This is the first for me, to actually feel this secure in my health care situation.
And he wants others to feel that way too, to finally be able to see a doctor when it's needed and not have to worry about the cost. Kimberly, Halkett, Al Jazeera, Washington.